Hey guys, Godfather of Anxiety here. Just wanted to make a short video about masculinity, ego, insecurity, and the way that they affect the diagnosis and treatment of anxiety disorder and clinical depression. Masculinity is a hot button word right now. It's become a little bit of a controversial subject. What is masculinity? What is appropriate for as far as the way men should act? What really is manly, which is really what masculinity is, right? But this isn't a video to be controversial at all. This is a video where I'm just going to help you guys realize that being masculine, what it means and what it doesn't mean. When we're talking about mental health in general, the perception of masculinity and what men think masculinity is one of the biggest things that gets in the way of getting the appropriate treatment and getting back on the road to recovery. So because anxiety and depression are not things we can see on a scan or test for on a blood test, often, because of the way men have been, raised, they feel as though it's some huge admission of weakness if they go and seek help for a mental health condition. Guys, that's idiotic. Would you think somebody was weak if they had cancer and decided to get chemotherapy? Would you think somebody was weak if they had a heart problem and they had bypass surgery to clear clogged arteries? Or if they broke a bone and they had a cast put on? Would that be your definition of weak? No, that's sensible, right? And somehow, as men, we've been conditioned, and partly, because of some of the controversy with, the whole thing concerning, genders right now and the differences, the things that are similar, somehow it's become an extra point of sensitivity for a man to, admit a mistake and for a man to go and get help for something that he needs. And now, granted, anxiety disorder and clinical depression are not mistakes, but they are things that you need to admit to actually having. And, I understand culturally sometimes, and even within families, we can be conditioned not to be willing to make, to acknowledge that we're sick. I'm married to a woman who was kind of raised that way, and that's why she doesn't go to the doctors unless she's, at death's door. And, and I understand, there to a degree, there being a lot more sense in making, in not overreacting to every small thing, because this life is hard, right? So I understand why you would logically not want to overreact and act like you needed help for every little thing and that you can't handle anything. So I understand how this can go the other way too. But for the most part, guys, men are not. It's just the opposite, right? What do? Well, we can't see it on a test. We can't, they didn't diagnose us with anything that they could see. So we're just going to try to tough it out. And this is what I tried to do. I tried to do this for a number of years. And all that happens when you try to tough out or white knuckle anxiety and depression is they get worse. Because you do need treatment. In my case, I needed medication to get me out of fight or flight. And that's another thing I want you guys to acknowledge that's really important. These are physiological illnesses. Although you can't maybe see them on a test, you are definitely stuck in fight or flight. And fight or flight has real physiological consequences. The release of adrenaline and cortisol and the effect that it has on every bodily function is real. And that's why the symptoms are real. It's not in your head. The symptoms of anxiety and depression are not in your head. They are they are a reaction, physiological reaction to the fight or flight response that is kept permanently on. And, again, it's very bad for your health, both physically and mentally. And you need to get treatment. You can't allow, there's a difference between being a man and letting your ego and your insecurity get in the way of treatment. I mean, reason it out. Use your logical mind. If you're not able, because in my case, I was not able to care for my family. I was not able to invest in my relationships. I was not good at my job. Nothing was going well when I was, not successfully treated for anxiety and depression. And by delaying treatment, all you do is delay recovery. That's all you're going to do. So you need to realize that being a man sometimes involves compassion for yourself, and the willingness to admit when you have a problem that might not be easy to diagnose on a scan, but is a real problem that you really need to get help for. And, it's funny, when I was untreated with anxiety, that's the bravest I've ever been in my whole life. Because I would love to see how many people would be willing to drive and do some of the things I was willing to do while they're having panic attacks, while they're feeling as sick as I was feeling. It was everything I did took courage. Going out of the house took courage. I became agoraphobic. So it's not some lack of courage. It's not weakness with these mental health issues. It's a physiological response that your body is doing that has real physiological consequences, and you have to get the fight or flight shut off. And it usually takes a little while. If it's been on for very long, it's going to take a little while, and it may take medication. So guys, try to differentiate. My whole purpose of this video is to get you to differentiate between being strong and being a man, and being logical and being intelligent, and being willing to realize when there's something that needs treatment, and to have the humility to go and seek treatment. Also, to have the humility to let someone who cares about you know that something's going on, that something's different. Because guys that allow their ego or their insecurity to keep them from doing this, guys, we know where this ends. So frequently, I'm sure this ends in tragedy. And if not the absolute worst case scenario where someone is no longer with us, then it's going to result in destroyed marriages and relationships and self-medicating with alcohol and drugs. Guys, it's not worth it. Take it from me. I have been through this, and it is so much smarter, braver, and more manly to go and intelligently get a health problem treated than it is to pretend to be strong. And that's what you have a lot in society today. You have a lot of people who mistake, not admitting to mistakes, overcompensating with, gigantic vehicles and, things that that project masculinity, that are really just a veil for the wild insecurity that's going on inside. And that has gotten really skewed in society today. And being a man, I would like to think, my father, my dad was, I thought, walked a really good line being both a man's man, but also showing me how to treat other people with compassion, and, you know, and also not to make excuses, because that's the other side of the spectrum too. And I'm not encouraging you guys not to be accountable, and I'm not encouraging you not to take responsibility for things. I'm encouraging you that when you need help, go get help. That's what you need. It's that simple. And, you know, that's basically what I wanted to say in this video, is just the way that the perception of masculinity and what being a man really means is being a strong, caring, compassionate person, man, to your family, to others, and especially to yourself. That's what being a man should be. Not pretending to be strong when inside you're full of insecurities. That's not manly, guys. Don't trick yourself into thinking that's manly. So that's about all I wanted to say. Thank you guys so much for the engagement with the channel. The weather's finally warming up, thank heavens. And hopefully, you know, soon I will have some more interviews on here. I have some ideas, some things in the works. But thanks so much, guys, and until my next video, take care.